Good morning. I'm Shawn Bennis. I am the coordinator of our Family Caregiver Program here at Henry Ford Health System. And joining me this morning is Rob Barrett. He is the manager of care coordination for Henry Ford Health System. So welcome, Rob.
Yeah, thanks for having me. I'm excited to talk about this exciting topic for our patients and our caregivers out there in the Henry Ford Health System world.
Wonderful. So today we're going to be talking about the AVS, or the After Visit Summary. And I'm sure it goes by many different names than those. And Rob is going to shed some light on this difficult, maybe confusing subject today.
Yeah, so thanks, Shawn, for bringing it up. So we refer to it as an after visit summary, or the AVS for short. And these are your discharge papers or your walk around papers that you used to get. They're the things you leave with after you leave either one of our hospitals, our clinics, or our emergency rooms. It contains a lot of different knowledge and a lot of the next steps you need to know, and we'll sort of go over those things.
So what are some important items or important pieces of that AVS? Because I understand that sometimes that AVS is many pages long, and many I mean like 10, 12, maybe even 20 pages long sometimes. So what really do they need to pay attention to?
So this is actually a perfect time to be asking this question. We're actually upgrading the after visit summary right now based on some feedback we got from our patient and our advisors. We have a committee that looks at these sorts of things, and they provided some really good feedback. So this new and improved version is going to have a lot more white space. It's going to be a lot more easier to read. And actually one of the biggest new features is actually this next steps box. It's going to appear right on the front page of your paperwork, and it's going to include really sort of like a checklist of things you need to do to ensure you're taking care of everything after you leave one of our centers. So,
wow, a checklist.
Yeah,
that's cool. I love checklists. I make lists all the time, and don't you feel more accomplished when you can cross things off of that list, especially as a caregiver, right?
Yeah.
I mean, the patients, of course, yes, but as a caregiver, you have so many other things going on in your life that you're thinking, oh my gosh, I got all this paperwork, I have all these things to do for my loved one. But now we're kind of making it a little bit easier for them.
Yeah, absolutely. So some things that could be in this list are maybe some medication changes that your doctor ordered, where you can go pick those up. It has your next appointment as well, and maybe some specifics if your provider really wants you to read some educational material that's attached at the end of your documentation. So It sort of takes that stack of paperwork and really puts those 3 or 4 really important things that you need to do in a very easy to find place.
Wow. Now sometimes I misplace things. So like today, I couldn't find my badge. It was in a spot where I wouldn't have put anything. Now what if I misplaced my discharge papers or my AVS, or what if the dog eats it?
That's actually a great question. And actually patients or their caregivers, if they have proxy access into those records, can go into My Chart and view those after visit summaries and print them right off from My Chart as well. So You have the ability to access it sort of from anywhere you want if you're a My Chart user.
So there's a good backup system. There's always the electronic backup system that we have for My Chart. So now what if someone has some more questions? So maybe the discharge papers are explaining almost everything I have to know, but what if I have an extra question?
That actually comes up quite frequently. So depending on where you got your paperwork from, there will be a different contact phone number up at the top. So if you're discharged from one of our hospitals, it will be a hospital-based phone number. If it's an ED, they have a different sort of call line. But I do want to encourage all of our patients and caregivers also, if they do have any questions about the care they received here, don't hesitate to call your PCP office, your primary care physician. We use a lot of different words to describe this. It could be your provider, you could see a nurse practitioner, but it's really that person you see that takes care of most of your care. We're using that sort of nomenclature for.
Okay, wonderful. So just to kind of wrap things up a little bit. So some of the important things that you talked about here for the AVS. So the AVS, again, stands for After Visit Summary. And you want to pay attention to your next steps, the medication changes. This is huge. I know that this is really, really important. Appointments, That's really important too. Actually, all these things are important.
Can I just talk about appointments for
Yes.
just 1 second?
Absolutely.
So we run into these questions a lot about appointments, and especially when you're being discharged from the hospital, it's really important for you to go to those follow-up appointments. Your provider or nurse practitioner or doctor can really answer questions about any medication changes, any other concerns you had related to hospitalization. And I know some people struggle with, why do I need to go to an appointment when I just got discharged from the
Yes.
hospital? But it's really to make sure that everything that may have been left over, maybe test-wise or results-wise, you can go over with your doctor and get those final answers.
Okay, that's a great addition. So your next steps, medication changes, appointments, where at this appointment you can go over these things that happened in the hospital, specific instructions, and then patient education. And again, all of this can be found in my chart in case you lose those actual pieces of paper. So if you have any questions, of course, you can put them in the comment section, under this Facebook Live, or you can always go to our website. You can email your questions to us, or you can call us. So our phone number is 313-874-4838, and I'll put our website and other contact information in the comment section. So thanks again, Rob, for joining us. You gave us some really valuable information. And again, excuse me, if you have any questions, please feel free to put those in the comment section. So thanks again.